Good evening, Facebook Live and Door County. Jim Heise, Chief Medical Officer from Door County Medical Center. I'm joined once again this evening by Sue Powers, Public Health Manager. Good evening, Sue.
Hi.
Thanks for joining us. You know, this is, I have to wish you a happy anniversary. This has been 1 month of this. This is our 4th Facebook Live since this all started. And you know, and it's kind of like a real marriage. You know, it's only been a month, but it feels like about 6.
It does.
You know, so, but that's kind of the way the world is right now with COVID, because, you know, we're all, those of us that are doing things correctly are all staying in our homes and socially distancing ourselves and that sort of thing. So time does seem to roll together. And I know before this we had great Facebook Live talking about what kinds of strategies and tactics we can do for our mental health during all of this, because this is something that none of us have experienced before. Right. You know, so I guess we'll look forward to your questions, and we'll start by having Sue give us an update as to what's new.
Sure, I'd be happy to. And I just have to add, it seems like the last week has lasted at least, I don't know, 6 months or so.
Something like that.
Yeah. Okay, so I'll start with the numbers, but I have to preface that with I'm all for data. I think it's really important, but I would encourage everybody to focus less on the numbers for a couple reasons. We know that cases are going to increase in coming weeks. That's the prediction from the experts at the state and the nation, and I think that's valid, especially because of the second reason I'm going to talk about. There's a real delay in test results. Some test results are taking 10 to 12 days to come back. So to some extent, you know, what we're reporting is not happening in real time. It happened 10 to 12 days ago. Some folks do get tested in a couple of days. The hospitalized, healthcare workers, long-term care facility residents, and emergency response personnel. Those tests can be sent to the state lab and they get done quicker. And also to focus less on the numbers and encourage everyone to stay the course with the Safe at Home initiatives. Okay, so the numbers for the state, as of today, positive tests were over 2,440 positives. Negatives were 25,574. Lots of testing going on. And unfortunately, over the weekend, deaths jumped quite a bit. There's been 77 deaths in the state. For Door County, we've performed in our county 131 tests. As of this evening, 7 are positive. And, you know, things change so quickly. We put our situation report about 4 o'clock, and sure enough, soon after that, we got another positive. Negative tests total 80, and so there's 44 pending, if I did the math right. I was going to also comment about community spread. So from the follow-ups we've done to date, which wouldn't include the 7th positive, we don't have any indication of community spread. So community spread means individuals have diagnosis with COVID-19 and they're not sure how they became infected. So to date, everyone's either had a contact that they knew of that had COVID, or they were in an area of more prevalent COVID activity. So in other words, from out of the state. I'm also going to talk about numbers on the Wisconsin Department of Health Services website. They now have county data. So at Door County Public Health, what we're planning to do going forward is put our numbers on our county website Monday through Friday. We have that capability and capacity, and we're going to work towards doing that late each afternoon. But on the weekends or any time, you can look at the Wisconsin Department of Health Services website and see Door County data, and it's really interesting to compare to the other counties also. Oh, the other update I was thinking about was, and perhaps everybody's seen this, the CDC came out Friday evening with recommendations about using cloth face coverings, especially in areas of significant community-based transmission. And today the Wisconsin Department of Health Services mirrored those recommendations. The rationale behind that is recent studies have shown a significant portion of individuals with coronavirus lack symptoms but can transmit coronavirus before they show symptoms. So this means that the virus can be spread between people interacting in close proximity, even if those people aren't exhibiting symptoms. So a cloth mask will protect others from getting illness from you. It won't protect you from getting illness from others. And it's not meant by any means to be a replacement for the social distancing that's recommended. That's really important. And we all need to keep doing that. And it's also not recommended that just being out in the community that anyone use a surgical mask or an N95 respirator mask. Those are critical supplies that continue to be reserved for healthcare workers and other medical first responders. That's all my updates.
Yeah, good update. Yeah, I would say, having been out, I was out on Saturday and had to go to the grocery store and get some essentials, and I had to get a light bulb. And so what surprised me was, I went to 2 different stores, and what surprised me is I don't think that people really fully understand what's going on here, because that the mask recommendation had come out the day before, and in both stores I was at, nobody had masks on, almost nobody. I think one person did, and me. And there were lots of people, and they were close together and all of that. So this is this is one of those things where I don't know how to be stronger about it, but we need to stay home. We absolutely do. The only way that we can continue to prevent more rapid spread of this is to stay home, because that's the way this is transmitted, from person to person, being close to someone, basically sharing your spit in some way or another, which is kind of the crude way of expressing why the cloth mask recommendation is in place. At the hospital, we have started now universal masking, which is to say every employee of the hospital has a mask on. If you are a patient-facing employee, which means, like myself, I take care of patients, I wear a mask, and I wear eye protection above and beyond my eyeglasses. If you're not patient-facing, if you're a financial services person or someone that is in an office, they should be wearing cloth masks. We also will be giving any patients or visitors that come into the hospital a mask when they come in. We don't really have a lot of visitors because we pretty much close the doors to visitors when possible, but we still have people coming in when they're ill, things like that, for other things, and we'll put a mask on them then. So really, staying separate, staying at home is really the order of the day, and we really should be following that and taking that very seriously. Someone had asked on here, community spread, that's a good thing, right? And the answer is yes, it is a good thing. It just basically means that we have a reason that those that have tested positive, we have a reason that they're positive. So they've traveled or they've been next to someone that had it, that sort of thing. Community spread just means we test someone, they have symptoms, they've been nowhere at all, no contact with anybody, and they still have it. That's community spread. We don't have that.
So if we keep doing the social distancing and those precautions, hopefully we won't need to have community spread. That's really optimistic, though.
It is. Let's see. Yeah, Andy Starr put a comment on there that I think it's worth reading out loud. Big shout out to all the volunteers making masks, especially sew masks for Door County and Kayla Bisson. You can drop off any of those masks to the ED or the valet entrances here at the medical center, and I completely second that. I mean, it's so appreciated. It really is. Good question was also asked: if you suspect you may have already had COVID, can you be tested for antibodies? I think that's a really good question. The answer is not right now, but soon. That is it's a technology, or it's an ability that exists for many other illnesses. We're able to check and see if you are immune to chickenpox, if you're immune to measles, things like that. COVID-19, because it's such a new virus, we don't have that ability yet to reliably test for those things. And I say we, meaning us in Door County, and also nationally. They're working on it. They're right now verifying that the tests actually are meaningful. So what that means is if I do a test, if I do draw blood and I want to check for an antibody to see if you are immune to it, that test actually, the result has to mean something, so I can count on it and I can say, aha, you in fact have had it. So that's coming, but it's not quite here yet.
Are those the 15-minute and 45-minute tests we've heard about?
Or
is that something different?
Those are different. The 15 and 45-minute tests that we've been hearing about, if you watch any of the president's news conferences, those are basically we call them PCR tests. It's basically a DNA test that currently is also being used in the state lab and in commercial labs. But there are new machines, new instruments that are out there that are able to do it locally. We will be getting a few of those tests. We have the instrument to be able to do those tests, and we're going to get a small supply of those. So right now we're working on a strategy to test those that it makes the most sense to test with that rapid test. We can get the result back in an hour, but unfortunately we can't test everybody that way. We can't even test most people that way, and we're not alone in that regard. There's a lot of people in the country that are in the same boat. The larger hospitals are getting that. We hear a lot in the press of how that's going to become widely available. I hope it will. We're not seeing it as yet. But I think it's a really good thing that our lab folks have done such a great job of being able to track down and get the test kits that we have. We're looking to be able to start doing that hopefully early next week. But that also, there was a question here that I wanted to answer that I thought was really, why can't we just test everyone? I have some questions that were asked the last time we didn't get to, and it's a really good question. Why can't we test everybody? It's simply a matter of supplies. And availability of those supplies. Swabs, testing media, test equipment, all of those things are in some cases short supply, but certainly not abundant supply. So if it were up to me, I would love to test a heck of a lot more than we're testing right now, because it would help us to draw a better picture of where the infection is and that sort of thing. But unfortunately, that's just not in the cards right now, and that's just not us in Door County. That's in Green Bay, northeastern Wisconsin, and certainly a lot of other places in the country as well. But that's one more thing the federal government is saying that they are trying to improve and get us. Whether we can count on that is a whole different situation. Let's see, and you mentioned the backlog, which is good. And I know one of the things that I would say is the last Facebook Live, there are a lot of people that were looking for information like, this patient that you say is positive, were they on 3rd Avenue at 5 o'clock last Tuesday? I mean, that sort of information, first of all, it's private. It's, if you had an illness that was reportable to public health, you probably wouldn't want it broadcast that, hey, this person has this illness. But more than that, it doesn't really help to know where it is. I think now that we have 7 cases, I think it's safe to say that all of us need to be acting as though the person you're next to has it. I don't think and when I say that, I don't mean it's time to panic or become afraid. I just mean that, we do have the recommendation to mask. I think we should be masking because I think that helps prevent spread. I also think that once you've come back from the store, once you've come back from wherever you've gone, washing your hands for 20 seconds with warm soapy water is a really good thing. Wiping down those surfaces to make sure that, once you bring groceries home, once you put them away, wipe down those surfaces with a Clorox wipe. Those are the things that we all can do, and they make a real difference as far as preventing the spread. And I think that's good news, because we all can do our part. We all can do something. And most of us, I think, as witnessed by the mask makers, people that are making the masks, I think a lot of people want to do something. And that's one of the ways we can all help each other, is wash your hands and be smart and be safe. I saw a comment on here a minute ago. They went to Cave Point and they saw a whole bunch of people picnicking and things like that. going outside and getting exercise is a good thing, but again, you should not be meeting your friends or your family or your relatives outside to get together. You know, walking and keeping 6 feet apart from everyone is what you should be doing. This is not a time to go tailgating while you fish. Wouldn't be the best idea because it's just going to spread the illness. Just because they're your friends or your relatives doesn't mean you can't spread the disease to them and they can spread it to somebody else.
I'm going to comment a little more on that question about identifying people that were positive, or why can't we know more about them, or where they were, or where they live. First of all, when we get a positive case, the process at Public Health is that we talk to that person, or if they're too ill, we talk to their closest relative and get information about where they have been for a designated timeline when they began symptomatic and 2 days before that, and what activities they did and who were their close contacts. And we follow up with all those close contacts. And certainly it may not be a perfect system, but we're pretty thorough and we try our best and to notify everybody who's been in contact with someone who's been diagnosed. And we do that anonymously. So if Jim is diagnosed with coronavirus, we can't go running around saying Dr. Heise has it. Mm-hmm. We just say, we call and say it's come to our attention that you were in close contact with someone who was diagnosed with coronavirus. And we're calling to give you instructions about what you should do regarding that. And it just wouldn't, like you went over, it wouldn't do much good to know where they lived or anything because it's here. We should assume could be anywhere. Yeah. And not to be fearful about it, but just to be practical about it and how we behave.
Yeah, and
our habits.
I did a little bit of reading over the weekend because I know last week there was questions about, what about takeout food and groceries and things like that. And so I really kind of wanted to know more about the virus on surfaces. And even though I'm not going to go through, I have it down here as far as how long things last on surfaces. But I think the important thing to know is you wash your hands frequently, you wash off those surfaces frequently, and you're going to be taking care of things without having to worry about has it been 6 hours, has it been 7 hours. So that's kind of important. I think that then the one thing that I did learn in the readings that I did is this is really spread. The mechanism of spread for the virus is the respiratory route, is by droplets. That's the way it's spread. Sure, you can get it if you touch a surface and it has, then you touch your face. That's certainly a possibility, but a lot of things have to happen correctly all at once for you to get infected by touching a surface. I'm not diminishing the fact that you need to keep surfaces clean, you need to wash your hands, not at all, but just recognizing that, understanding the main mechanism that it's being passed on. So if you're worried about going to the grocery store to get groceries and having them on your counter, and then you go to meet your friends at Cave Point, that doesn't make any logical sense because you're increasing your risk by going to Cave Point with your friends and worrying less about the groceries on the surface.
On the Department of Health Services website, they have a page, How to Protect Yourself from COVID, and they have different tabs for questions. And one today was new about the fabric masks, but they also have one about grocery shopping and some other questions you might have. They go over some tips.
Christina had a good question. I know you said that the typical turnaround time is 7 to 10 days. Is that based on just using one lab, or are the tests going to multiple labs to decrease the turnaround time? We're looking on a daily basis to see. The answer to that question is we're using one lab. That doesn't mean that we couldn't use more than one. Everyone's in the same boat. The labs are, because of the volume of tests that are coming through, the labs are the bottleneck. So we use one lab because we get the fastest turnaround time from them. The other lab that we had used when we first started all this, the turnaround times got out to about 14 days, and that was not tenable. So that's why we made the switch. It wouldn't help us to divide it up and do some to this and some to this because it would still be that same length of time. Good question, though, because believe me, we think about this every day. What can we do to shorten the amount of time it takes us to get the results back? And doctors hate being out of control. And the fact that we order a test, I want the test done, I want that result, and it's gone for days is nothing short of maddening. So, and I'm sure even more so for the people that are tested and they want to know what the results are. I will comment though, the more important thing is if, let's say for the sake of argument, you've been tested and because you felt kind of crummy, and as you're waiting for the testing, you're getting better. The getting better is the part you should focus on. It'll be helpful to know in the end what the test result was, but the getting better part is really the most important. Because one of the things that we do, as a doctor, when I order a test, I have a specific question that I want to answer, and I need to know what the answer to that question is going to allow me to do. So if I want to know if your sugar's high, I check a blood sugar test. But if I don't know what to do with that, or if there's nothing I can do about the blood sugar, once I get that test result, the test isn't very good. So that's kind of where we are with the COVID test. Is we get it back, we know it's positive or negative, but that doesn't change how we treat it or what we do. And I'm not saying that because I don't think we should test. I said a minute ago we should test a lot. If we could, we should test a lot more. But it doesn't say that if I knew you were positive, I would do these 3 things, and because you're negative, I won't do those 3 things. It's all basically the same. If you feel you've had it and recovered, can you be tested for immunity and donate plasma? The answer is kind of. The answer is yes. I've seen that in the larger cities they call it convalescent plasma, and all that means is you've recovered from COVID, and then the plasma can be used in critically ill people to give them a plasma transfusion, and that should introduce some antibodies. We don't have that ability to do here. I don't even think that's happening in Green Bay at this point. So that's one of those technologies that if you're in a large city, in an academic medical center, that might become an option. But right now, we don't have that ability here. If you're positive, a lot can happen in 10 to 12 days. That's exactly right. That's why what we tell you when we test you is don't go anywhere, stay at home, and keep out of contact with people. So if you say a lot can happen in 10 to 12 days, that's on you if you decide to leave the house, get in your car, and drive all over the place. So once you've been tested, you get a specific set of instructions that say this is what you should do and don't do. And so that's why this almost is a social covenant for all of us. This isn't going to get better unless we all work together and do the right things.
On the flip side, we've had some people be completely recovered by the time they got notified of their positive result, and we followed up with them then. It's a little bit of water over the dam, but it's really important to know.
Let's see what else is here. If someone's in their 20s or 30s has traveled outside of the country in a high-risk area and they are asymptomatic, they don't have any symptoms at all, could they still be a carrier and could they still transmit? The answer is yes. That's the reason for the masking, is we've begun to be able to quantify the fact that viral load is present before symptoms exist. And that is the entire reason why I've started to say to people, assume everyone has it and act accordingly. That doesn't mean everyone has it, but if that's true, which I believe it is, that some people without any symptoms at all can have the virus, it can be spread to someone else if you're too close or if you don't exercise good precautions. So the answer is yes. The reality, though, is we're not testing asymptomatic people because the yield of the test when someone has no symptoms is very low, as it turns out, even though there could be virus present. So that's why you just have to assume, and especially if you get that kind of story that I just mentioned, that they traveled outside the country in their 20s or 30s, they're feeling fine. That's kind of what we use as far as trying to make decisions. I just came back from, if someone says to me, I just came back from Italy, I was at a place where I know someone had it, I'm feeling fine, just wondering if I could have it. Sure, you absolutely could have it because you were right in proximity, and you may have it, but it may not show up positive on a test.
And everything you just described is why the recommendation is the quarantine for 14 days.
Right, exactly. Are you expecting a spike of cases in Door County as the rest of the country is expecting? Should we be surprised by the increasing numbers? Yes, I fully expect a spike in cases, and it's easy for me to say, no, you shouldn't be surprised. I won't be surprised. What I would love to be able to say in a couple of weeks or 3-4 weeks is, you know what, the spike never came. I said we were going to have more, it never came. I would be delighted to be wrong on that, but I think all the data that we're seeing would indicate that that's not happening. I mean, the reality is we've had a new case every day since April 1st. Only one, but that says something. So our doubling rate is certainly there. It took a number of, probably over 2 weeks for there to be a positive test, and now there's a new positive every day. Mm-hmm. Thankfully, they've all been traveling, and they have reasons that they have it. But it at least helps to know that it's not community spread. Let's see. Well, someone asked with the election tomorrow, what's the best advice you can tell people on how to feel safe if voting in person? I thought that the governor had said no in-person voting.
He did, but there's some controversy about whether that's
okay.
actually going to be what happens.
Yeah.
I believe the state Supreme Court is going to do something this evening.
Okay.
That's the last I heard.
Okay. Yeah. I mean, the clinical answer, the doctor and me will say the best bet, the best bet would be to be able to not have to go there and vote, because obviously it goes against everything we're talking about, staying at home and that sort of thing. And I guess that's where I'll leave it. I mean, I don't, my purpose is to not at all get political, but yeah, trying to stay away would be the best. Yeah, Supreme Court overruled the governor. Okay. So I guess I would say if you're going to go vote, wear your mask, wash your hands like a fiend when you get home, stay 6 feet away from people, don't touch a lot. What other questions on here, Sue, should we try and address?
Do you want to talk about the process for drive-through testing?
Yeah, it's kind of a misnomer. I mean, it's drive-through testing, but it's, again, there's a hotline that you can call it if you're concerned you may have it, or you have symptoms, or even just questions. But if you think you may have it and the symptoms are concerning to you, that number is 746-3700, and we're open every day 8 to 4:30 in that location to answer questions. So you can do that, and if the nurses that are taking the call think that testing would be advised, then they'll have you drive into the dental clinic where there is a tent. They'll have you wait until they come out. They'll roll your window down. They'll swab you right there in your car, and you'll drive off, and then we'll get back to you with the results. We actually have not had, we've had kind of a slowing down of people coming, people calling, asking questions. So it's, I suspect that people are either resigned to the fact that, okay, it's around, and maybe they're just not feeling that, they're not feeling any concerning symptoms. I mean, I think it's good news. I mean, I keep hoping that we've done the right things, and the curve is being flattened.
Right. Well, I think the seasonal flu rates are down, and maybe other seasonal viruses are decreasing, so yeah, that might indicate less testing. Governor
ordered the stay at home until April 24th. Do I think it'll be extended? I do. I don't have, that's just my gut. I don't have anything other. I do think it'll be extended only because I'm not sure if I've seen some data that suggests that the peak for the state and the country could be sometime late this week, or is it early? Is it late next week? So I've seen a couple of different dates. The first date I saw was April 27th, that area, and I think the most recent one this morning was a week earlier than that. So I think if either of those come to pass, it's going to take a while for that curve to start to drop. So I would imagine we're looking easily well into May for things to begin to quiet down. But that's completely a guess on my part. That's not based on any particular knowledge.
Here's a question I'm curious about. How's the staff doing at Door County Medical Center?
That's a really good question. I appreciate that. I mean, the staff's doing really wonderfully. I mean, I have to say, it's and I'm not just saying that. I mean, I've worked at large hospitals in the Milwaukee area prior to working here, and we just have an amazing group of people that work here. And every time I come to work and see it, I know I'm in the right place, because people are working so well together, and we all have a good sense of resolve. I mean, sure, we all have some degree of fear. I mean, I think you'd be foolish not to have some degree of fear. But I think we've done the best we can to try and communicate the things we can do to protect ourselves and mitigate that fear. It's never going to be 100% gone, but I think my sense of it is that overall people are doing really well. Another question that was on this list is, do we have enough PPE, again, personal protective equipment that's everyone's talking about? We actually are in really good shape at our hospital, and we're very thankful and blessed that that's the case. But every day we're looking at our burn rate to see what it is we're using and what are our supplies. And our supply chain folks are doing a wonderful job of keeping on top of it to the best that they can. So, I don't see it happening here like we're seeing in New York, where doctors are having to go without. I don't see that happening at all. It doesn't really even cross my mind that would happen. So, hope that answers that question.
While he's looking for another question, I just want to give a shout out to the staff at Door County Public Health that are amazing and resilient and work hard, and we've had great support from the other units of Health and Human Services. We've recruited some folks, and county administration has been great support also. Oh, and of course, I can't forget my new best friend, Dan Kane, emergency manager. He's taken up residency in the public health area.
Yeah, and there's been a number of nice comments on here. I really appreciate the kind words that people are putting on here. How do you care for a fabric mask? Can it be reused? How should you wash it? Being that it's a fabric mask, yes, you can absolutely reuse it. In fact, it's encouraged that you reuse it. You can launder it like you launder any whatever the fabric is made out of. It's normal laundering is fine. Even when it comes to, for those of us that work in healthcare, a big topic of conversation is, what do we do with our clothes at the end of our time in the hospital? We go home for the night. What do we do with our clothes? And you hear varying stories about some people will take off their clothes, put it in a plastic bag, leave them outside for 48 hours, and then bring it in and wash it. I read an article this past weekend that basically said, in fact, it's sitting here in front of me, coronavirus on fabric. And this is from Johns Hopkins, and it talks about evidence suggests it's harder to catch the virus from a soft surface such as fabric than it is from frequently touched hard surfaces like elevator buttons or door handles. It basically says, this says, wash it right away, especially wash the hard surfaces. Wash your clothes, dry everything on high, since the virus dies at temperatures above 133 degrees. Then this particular article says, file these steps under abundance of caution. So I've also read articles where it says, only wash whatever fabric you've got, and I've kind of branched into clothing, but only wash what you have to the temperature that you should. So if it's a 100% cotton t-shirt, you don't have to wash it in hot. Warm would be good. But in most cases, the act of doing that and drying it should take care of it. I tend to not be an overkill kind of a person. I'm not saying that leaving it out in the garage for 48 hours and then washing it is wrong. It certainly isn't. But I tend to, I'm less concerned, I think, about that. Let's see. Handling to-go food. What should the restaurants be doing? A customer bringing it into the home. Restaurants. I read somewhere which I thought was really interesting. The places that I use for takeout that I frequent, I trust. I have a good trust. They do a good job under normal circumstances. So I assume that they're doing a good job with takeout. I read somewhere that one of the recommendations, if you're really concerned, look under there's a place that you can find restaurant inspection files. Look under there, and if they've got a crummy inspection during normal times, that might inform you as to what you should think about that particular restaurant. Specifically, when you bring home food, the recommendation is to bring home the packages, transfer the food to one of your plates, use your own silverware, don't use plastic silverware, and then throw away the disposable cartons that the food came in, and eat it on your normal dishes and your normal silverware. And again, before you start eating, wash your hands. That should serve you pretty well. Is the cough associated with COVID more of a dry cough or a productive cough? Dry cough. We're seeing a lot of dry cough.
I've read that a common symptom is loss of sense of taste and smell. Are you seeing that?
Mm-hmm. Excuse me. Yeah. I don't think we've seen it personally, but I've heard it. I've heard it, and I know colleagues of mine that work out of state, they've seen that as well. So loss of taste and smell seem to be going hand in hand with this. Let's see. Did I answer questions about carpooling? Well, I did. I missed the question about carpooling, but what I would say is, don't do it. You're in a car in close quarters, even with a mask on. A good point. I think you might have mentioned this, Sue. Just because you have a mask on, that doesn't mean you can go and have all kinds of parties at home, because we all have masks on and we're all protected. It's still that's just one more piece of protection. The 6 feet apart rule is a good piece of protection. So, and I say that recognizing that some people carpooling is the way they get around, and so I don't mean to sound insensitive or brash, but that's I guess carpooling doesn't make a lot of sense. With respect to our snowbirds that are currently still away, do you feel that we could have a second peak once they start making their way back? Gosh, that's a hard question to answer. Have you heard me?
No, I want to say, geez, I hope not.
Yeah, exactly. I don't. That is the concern, and there have been models out there that we see a peak and then it goes down back to nothing, and then I've seen where it's a bump. It does like this, and so I think that's why there's too much uncertainty as far as when are we going to get the economy back rolling, when are we going to be able to start booking vacations again. I think it's just too soon to know. Let's see. I heard in the conference that pink eye could also be a symptom. Yes. Yeah, that absolutely can be a symptom. We're seeing that as well. Dr. Fauci says there needs to be more clinical studies to be done on the effectiveness and the use of hydroxychloroquine. Is there a shortage in our area? Are people who take hydroxychloroquine for lupus or rheumatoid arthritis less likely to get COVID? The last part of that question is interesting. I don't know the answer. I wish I did. As far as our people that are already taking hydroxychloroquine, are they getting it less? I don't think we know. I think that might be one of those things that when we go back retrospectively and look at the cases that we know, you can do an analysis and say, it turns out the number might be lower. I think Dr. Fauci is spot on. I don't think we know enough about hydroxychloroquine yet to say for 100% certain. It's not that it's a bad idea at all. And I've heard the president say, what's it going to hurt? Just try it. And I don't entirely disagree with that. I mean, any medication that we give, including Advil, has possible side effects, and so there's things we have to be cautious of. when we give any medication. But I know there are several hospitals in the area that are using hydroxychloroquine. Do we have a shortage? I mean, I guess I'd answer that, it's a supply and demand situation. Do we have a shortage? No. Do we have easy access to it? No, we don't. So it's, if we run out of it, we're out of it, at least from the hospital pharmacy perspective. That doesn't mean that Walgreens and Walmart don't have it. It just means that we as a hospital don't have it. So like anything, we try to make responsible choices. We want to make sure that it's going to do something good for the patient and also not deplete necessary resources. With someone who has asthma, are steroids dangerous if you possibly have COVID? There's an interesting level of discussion about steroids, prednisone, and things like that. Initially, the information coming out of the centers that had the first cases, they were saying, don't give it, it's like throwing gas on a flame, it makes matters worse. They're kind of softening on that. I just read somewhere, and I broke my own rule. I always say, if you start a sentence with, I just read somewhere, it probably isn't going to be right. But I at least looked at one of the protocols from another hospital out of state, and from people that I trust and that are knowledgeable, and they've said that may not be as big of a deal as we thought it was. And so that's kind of one of the challenges too, and one of the interesting parts, if there is such a thing, about this whole situation is that things change on a regular basis, and we literally are. Most of us have contacts and colleagues all over the country, and we are constantly getting, I have a stack this tall on my desk of different protocols from different hospitals as to what are they doing when someone's in the ICU, what do we do, changes on a pretty regular basis. So we're less worried about steroids than we were earlier. Let's see.
You touched on something that I think is hard for all of us to live with, and that is what's going on today and what's recommended today is changing tomorrow, and it keeps happening.
Yeah. I agree. It's
unsettling, and we're not used to that. We're used to somebody making a recommendation, and we follow it for quite a while. I've said this repeatedly. We really try we try to go back to our source of facts as we understand them, and that is the CDC. And they've done a decent job of coming out with what's the most recent data that exists, and they make changes, and there are times you can sort of tell when they're ready to make a change to their guidelines. They'll hedge their bets a little bit, and we got ahead of the curve as far as masking here in our hospital, because it seemed like they were going in that direction, and we gambled correctly because they now have made that recommendation to universal mask. So we try to stick with what we understand to be the truth, and we also use our colleagues down in the Green Bay area to really help us to know what we're doing, and as far as are we making the right decisions. I wanted to point out, because I agree with this, not just because he's my boss. Denise says, a shout out to our CEO, Brian Stevens. He sure came in at a difficult time and took the bull by the horns. I could not agree more. I think that's absolutely true. He's, I pretty much daily think to myself, what have I been doing my whole life? Because he's a man who's probably about 10 or more years younger than I am, and I wish I had the kind of poise. So, it makes me, as someone that works here, very secure that we're heading down the right path and we're doing the right thing. Let's see. What are they currently using as a cure to help it? People who have asthma have a high risk, and where are they at? There's no cure at all. I mean, that's the problem with all this. It really is supportive measures, and so, we treat the best we can with oxygen if necessary. If someone requires oxygen, much of this is time. There are some of the medications that we already talked about, hydroxychloroquine, things like that, and those results are not 100% certain yet. All right, I think we'll just take a few more questions and then we'll call this an evening. Is it a good strategy taking vitamins, getting good sleep, and reducing stress to boost your immune system? Will this help prevent getting sick?
I think getting good sleep reducing stress is always a good tactic, always. Vitamins, I could talk for an hour on vitamins. Vitamins probably don't, under most cases, vitamins don't hurt you. They're fine to take. The medical side of vitamins is if you eat a reasonably balanced diet, which unfortunately many of us don't, if you eat a reasonably balanced diet, you're getting all the vitamins you need, and taking a multi is not necessary, but it's also not going to hurt. So I guess that's all I'll say about that. Yeah, here's a question I'd like to address. How many ICUs and how many ventilators does DCMC have? I cannot tell you the number of times I've been asked that question over the last month. And the press especially loves to, they want to know because it's a very juicy thing. I mean, and the short answer is it doesn't matter what number I tell you. If I told you if it was 5, is that enough? Is that too much? If I told you it was 15, is that too much? Is that not enough? The number is not really that important. The other thing too, and I think this every time I hear the discussion at the national level of how we're making thousands of ventilators and we're sending them to places. Not that that's a bad idea, that's the right idea. But in our area, number of ventilators is less important than the staff we have to be able to appropriately manage the ventilators, manage the patients, take care of the patients on a ventilator, things like that. So, as far as how many intensive care unit rooms do we have about 14, which is actually 3 times more than we started with. Being a critical access hospital in a small community, small area, rural area, critical access means we have 25 licensed beds. We can probably flex up to 50 beds if we have to. We're lucky in that we have space. Again, it's not space, it's not equipment, it's not beds as much as it is the staff to be able to treat those. Our normal ICU is 4 rooms. So I have as much confidence as I possibly can have that we can take care of a lot more patients than we have in this building. So obviously what we don't want to see is we don't want this surge of patients that initially was talked about, and we're seeing a little bit of backing off on that conversation that all the ICUs in the country will be occupied by a certain date and all the ventilators will be used by a certain date. That's why people in my business are harping on the social distancing, wear your mask, things like that, because if it happens that a lot of people get sick, we are going to do the best we can to take care of each and every patient that comes through our doors. But, all you got to do is look to see what's happening in New York. Doesn't mean that can't happen here. As I mentioned before, I've worked in big hospitals in the city. This is a smaller hospital, but this is a wonderful community hospital. We can do a heck of a lot at this hospital. We just have to be smart about the resources we have. So I appreciate that question because that's one we've been getting, and I hope that was a little bit comforting. Will public health be proactive by reminding snowbirds to self-quarantine when they come back home? You want to be proactive and say that right now?
Yes, I would like to be proactive and say that right now. We've been getting that message out any way we can, recommending that all the time. We've had several press releases about that, and we'll continue to say that. Anybody who returns needs to self-quarantine, but first of all, we're discouraging travel.
Absolutely, absolutely. Especially now. I mean, really, if you decide to travel just for some kind of a vacation, I guess I'll say it, you got to have your head examined. I mean, there's no reason to do that in any universe. Let's see. This is an excellent question, Holly. If someone contacts or contracts COVID-19, what's the best home care? When should they go to the hospital? It's an excellent question. Generally speaking, we're seeing in over 80% of the cases that it's a benign illness, which is to say it's like a horribly, horribly bad cold or the flu. Influenza, if you've ever had influenza, it's kind of characterized by a high fever. You feel like you've been hit by a Mack truck. You have a cough, you have no energy, and that lasts about 7 to 10 days. This is what they're saying COVID is a lot like. In fact, some of the accounts that I've heard over the weekend where it's even worse. Someone feels like they literally, their bones are breaking and their body aches are so severe. So the best care at home is just trying to get as much rest as you can, make sure you're drinking enough fluids, Food is less important over the short run, the 2-3 day mark. It's not that crucial that you have a meal. But keep yourself hydrated, get plenty of rest. And if you begin to get short of breath and you're having a hard time getting your breath, that's when it's time to seek help.
Do you want to comment on using Tylenol or ibuprofen if you're sick with COVID?
Yeah, that's something else that's actually changing as well. Mm-hmm. Initially, there was a lot of information out there that was talking about ibuprofen can make matters worse. And so don't take ibuprofen if you have fever or body aches with COVID or with a suspected case of COVID. You're better off using Tylenol because that won't cause a problem. I think that probably is still good advice. I'm reading some studies that are beginning to question whether it's in fact true that ibuprofen makes matters worse. So I guess I wouldn't change my recommendation. I would say continue with Tylenol over ibuprofen. But I guess the fact that the studies are starting to waver hopefully will give some solace to people that are saying, oh my God, I've been taking ibuprofen. What if I get it? I'm going to be in worse shape. I don't know that that's demonstrated yet. Could you please give more information on what it means to self-quarantine when you've returned from traveling?
Sure. It means don't go to the grocery store, just go home and stay home and don't have friends over. Have your groceries delivered if you need them, but have them left out on the porch and you get them in later. I'm not sure what else to say about that. Just stay home for 14 days.
Yeah.
And visit with people by phone, by phone or over the internet, but not in person. Don't go out.
All right. Well, I think, what time is it? It's 10 to 7, so I think we're going to go ahead and wrap this up for this evening. Any last minute words of wisdom or advice? You've already given us lots of wisdom, and I appreciate that.
You've answered a lot of my questions tonight. I've learned something. Thank you.
Oh, yeah, my pleasure. Okay. I'm being held up a question, my cue card. Use of albuterol if sick. I'm not sure I understand that question, but you can certainly use albuterol. I think if I read between the lines, what that might be talking about is in the hospital setting, we use a nebulizer treatment, a machine that actually nebulizes and you breathe it in as opposed to just puffing. The nebulizer machines cause, if you have the virus, it causes it to aerosolize, which means it goes into the air, kind of like a hairspray mist. And that can be dangerous for healthcare workers and for other people around. So the recommendation is to use albuterol inhalers, the puffers as I call them, to use those instead of the nebulizer. So if you've got them at home and you're using it for your asthma, you're fine. All right. Well, I guess all I can say is make sure that you're doing your best to socially distance yourself. Stay home right now. I think this week of all weeks is a really good week to absolutely double down on our efforts to do that. Take care of yourself. Connect with people. Call people on the telephone. Use FaceTime, Skype, whatever you do. Connect in that way without contact, but just keep yourself connected. I have no doubt that we'll get through this. So at this point, we'll plan on another one of these next Monday,
Okay.
if your schedule allows.
Certainly.
And we'll try and give you any updates that we have before that time. Thank you all so much for joining us. I wish you all the best and take care.